So let me just give you, I'm sure many of you know all this, so I'll just give a very, very brief overview. And of course, we write about this a lot in our, about the social welfare system. We write a lot about it in our publications at the Taub Center. So you're of course, you're invited to look at our material or to contact me, and I'll be happy to provide anything additional. In principle, Israel has a relatively comprehensive welfare state, social welfare system. We have social security, that covers virtually every major social problem, provides some sort of assistance, some sort of response to major social problems. We have, of course, a universal educational system, a national educational system. We have universal health coverage, which is crucial, of course. Population live below the poverty line, which is very high compared to other countries, and about a third of all children in Israel live in poor families. So that and the fact that there is access to by everybody to the health system, of course, is very, very important. So on the one hand, we do have what we call a relatively universal welfare system. Social spending, which is basically how much we spend on social welfare in Israel, is relatively low. And here's the downside of our social welfare system. So we spend about 15% of our GDP on social welfare or social protection. And this has been more or less the same for the last 10, 15 years. That's low compared to most other OECD countries. In fact, we spend less on social welfare as a proportion of our GDP than the United States does. So we have a comprehensive system, but spending is relatively low. And that the spending is low mainly because many of the crucial elements in our social welfare system are underfunded and understaffed. So benefit levels, social welfare benefits are relatively low and sometimes difficult to access. Health spending is low in Israel and perhaps too low to really provide the sort of adequate services that we provided in the past that we should be providing today. And this is true of other sectors in the social welfare system. One result of this relatively low spending is that we find it very difficult to deal with poverty. That's not the only reason there's poverty, but we find it difficult to deal with poverty. And as a result, about a fifth of the population live below the poverty line, which is very high compared to other countries. And about a third of all children in Israel live in poor families. So this is a really very problematic issue that we really don't deal with well enough. Inequality is relatively high in Israel. It's dropped a bit in recent years, but it's still much higher than most other OECD countries, which is also, of course, something that at Taub and in general, I think worries us a lot. And this has, of course, implications for people's health and people's being part of their community. And in particular, this is true of two segments in the population: the Arab population, which is about 20% of the Israeli population, and the Haredi population, which is about 12%. These are the two populations which, for different reasons, poverty is particularly high. To just give you one indication, about 50% of all Arab families live below the poverty line. So this is, for us, a major issue. In Israel, what has happened over the last two and a half decades is that there's been a lot of outsourcing of social welfare and social welfare services, or the government has been leaning a lot on the non-profit sector, on civil society. In Israel, at least in social welfare, the situation is that a lot of services are provided by non-profit or for-profit agencies, and with the government funding a lot of these services. So government is buying services from non-profits or for-profit enterprises. This has its advantages, but in a period of cuts, which we began before the crisis, and of course this has become even worse now, in a period when the government is cutting spending, this, of course, creates a major problem for agencies, for non-profits or for-profits who have a very, very difficult time keeping afloat in a period where they don't have a lot of money saved or resources saved, which is something the government very often has.
Normally, the food comes about 10,000 cooked meals every day from hotels, corporate cafeterias, events, and the army. So you can just imagine what kind of crisis we are going through right now. Meals have gone from 10,000. I think today we are down to something like 400 or 500 from the last 2 army bases that are actually open for us to come into. And the other side of what we do, fruits and vegetables, again, everything is, there's a tension in the work of Leket. Fortunately or unfortunately, depending on which side of the coin you're at, we are getting way more opportunities to get fruits and vegetables than we normally do. And that's primarily, again, because of the closure of the hotels and the borders and the corporate cafeterias. Many, many farmers who normally sell to those markets have nowhere to sell it. They're not set up for selling to supermarkets or selling in other ways. And therefore, they're calling on us or we're calling on them. And so we've actually increased the work we're doing with farmers, both in cost to us and in the amount we're distributing, by about 50% over the last 2 weeks. And last but not least, meals, which we normally get for free. We're currently purchasing 10,000 meals every single day from 4 formerly shuttered catering companies who normally give us food for free.
We have groups that have always been vulnerable and are now even more vulnerable. This, of course, is people. Is people living in poverty who have very, very little income at the moment and didn't have before, and are living in conditions which are very, very difficult, particularly large families. So this is true, particularly of the Arab and Haredi populations, and the uncertainties and risks that these families are faced with are really causing a lot of pain, a lot of difficulty, and also tensions within families. And so we have a rise, for example, in violence within families, which is an issue that many of my social workers are really trying to deal with. The elderly, particularly those in some form of in nursing homes, etc., are really suffering a lot during this period, both from health issues, but also from isolation, loneliness, and a lack of the system. Our system is really having a very serious problem, being able to deal with the needs of this population. And one last group that I think we should think about are people with disabilities, children with intellectual disabilities, or people with physical disabilities who are in institutions and isolated from their families, are also going through this period with facing a lot of difficulties, being isolated, being stuck in these institutions without really understanding, without being able to connect with the people who provide them support, usually their families.
I want to, tell the story of the impact here. I think it was last week, I got an email from a certain lady that lives in Givatayim, city in the Tel Aviv. And she said that she and her sister, which lives in Jerusalem and is not in the best economic situation at the moment, are dealing with their parents who live in Ashkelon, which is in the south, probably about 60 kilometers south of Tel Aviv. And they're elderly. She's 86 and he's 90. And until last week, they were able to go and visit with them and bring them food for a few days. And then, but since the new regulations came into place, they are going to do. And this, apart from the social problem here, it also demonstrates, I think, What the problem is with a lot of Israelis now that don't know where to go to get services, or before they were maybe teetering between poverty and not. But now, since this corona, since the pandemic came in, then they're not teetering anymore. They are considered now. Their problem is that they don't know how to deal with the system. Then the system to get the help that they need, and they might be elderly. There might be families that the two parents have been let go or are now in forced vacation. And we see a lot of calls coming in from these people. So that a lot more people are joining the system, and there's a need for the food that all the organizations, and not organizations, there's a big need for food out there. So we see a lot of these people. We see a lot of elderly people that we deliver the food for them. And we're probably the most. We give them most of the food for their for the day, for the week. But also other organizations join in as well as that. It's not only Leket that serves food, but it's also other organizations. So there is currently, I think, I don't know if to say enough food to go around, but I think nobody needs to go hungry at this point. I think after Pesach we'll see. A huge change in this, seriously, a huge change in this, because all these 1 million people, and that's a number that we're quoting now, that are now unemployed, that's a new number, start to seek assistance somewhere. And that's going to be where the real trouble lies. But we see it going, we see it happening everywhere. We see it with kids in schools that have received food from the government before. There's a government feeding program in schools, and now that is stopped for the last 3 weeks, and these kids are at home. And you know, when you're at home and you're stuck before the TV or whatever you're doing at home, and you really can't leave, so the first you start eating more. And these families, can they afford the amount of food that is now on their table or not on their table as well? So how do they source the food? And we see that, and we're trying to address this as well, and trying to find and working with the authorities in order to find these kids and families and give a solution for the family. Now it's not only the child itself, for the family, and the family can be anywhere from 4 or 5 up to babies than that. So we see a lot of need out there, food, and I suspect this need is going to grow tremendously in a few weeks after Pesach. You know, see farmers now also in a difficult situation. A lot of farmers have a lot of produce, and they have no one to sell it, so a lot of it stays in the fields. We're getting to as much as we can. Hopefully we'll get to even more, but we see a lot of that produce in the fields. And then you look at the farmers themselves, and we ask ourselves a question: are these farmers in need as well? They don't have who to sell their produce to. 2 big channels being closed down, as Joseph said. The tourism and the food services and catering services have closed down. So who's buying their produce except the retailers?
Where we are today, I never imagined. This is so much worse and bigger than what we're used to, than what, Israel's used to crises, right? But usually it's one way, it's only here, and everyone from around the world wants to support us. And, now this is everywhere, and we have to be cognizant of that. Yes, I could look, just from a Leket point of view. So I got a report today which said that Leket normally distributes to about 200 different amutot, 200 different NGOs. I got a number today that we're working with 398 NGOs right now, okay? So new partners. We're working with more than 25 municipalities directly, which we never normally do because it's not necessary. The agencies in those cities are usually sufficient, but the demand has been so great that many municipalities have opened up emergency feeding centers where Leket and other organizations bring the food, and then they have local volunteers, as an example, who distribute it. I'll give you one example. In Modi'in, there's a wonderful Rabbi David Fine, who has a center called the Barkai Center for Practical Rabbinics, and he's put all his rabbis in Modi'in to work recruiting volunteers and then distributing the food that Leket and others deliver there. So municipalities, new charities, and of course the Israeli army, who we're one of the few organizations that are working directly with the army, again, them distributing food on our behalf. And actually the army, McDonald's, and a few others have given us trucks that they're not utilizing with their own drivers at our disposal. Not as good as our own drivers, but still not bad.
I think NGOs and people volunteering are really playing a very important role in addressing this crisis, as is always the case, and in fact is true for even for regular times in Israel. But I think what we've learned in Israel in this crisis, and what I think people have learned all over the world, even in the United States, is that in crisis, but also in other times, if we want to address social risks, we need the state. We need governments. We need governments to step in to be able to utilize resources. The governments have the resources. The government has the ability to organize and to reach people that normally other people or other organizations or other sectors don't reach or can't reach on a long-term basis. And I think we should learn something from this. That it's fine to cut taxes and underfund services, and to let civil society or private enterprise provide the needs of people. But when crises emerge, and perhaps not only when crises emerge, the government really has a major role to play. And I think we're learning that the hard way now. And I think that's a message that we have to take not only today, but when this crisis ends, we have to think hard about how much we want to underfund social welfare, social protection, health, and educational services, and what the implications are that for everyday life, but also for times of crisis. So I really think we should recognize the role of government, and particularly the people who work so hard in the government or in government service to provide for needs of people. I'm thinking of, the health workers. I'm thinking of the police. I'm thinking of social workers, people who are really working very, very hard now to deal with so many problems, so many issues, and perhaps there's not enough of them and they're certainly getting very low wages. And I think this is something we need to think about very seriously. And I think the underlying sentiment is really something that we at Taub we've thought about a lot, and I think it should worry us. Just to give you some data, just to give you an idea, 80% of the budget of the Ministry of Welfare goes to outsourcing. So it's basically money being services being bought by the ministry from either for-profit or non-profit organizations, which has a lot of advantages very often, but it also creates it diminishes the role of government. It gives a lot of power and puts a lot of responsibility on the shoulders of non-profits. And these non-profits, as you're saying, have got very weak over the last year or so because there's been no budget, of course, approved by the government of the Knesset for the last over a year, which means that funding has been cut to non-profits, and these non-profits are really not being able to provide the services that we're counting on them to do. Non-profits have a very important role to play, and they have a lot of advantages over government, but we should really be thinking what they should be doing and what the government should really take responsibility for and make sure that it can provide certain services all the time in crises and during the regular times. And we shouldn't be counting that so much on non-profits or for-profit agencies as I think we have done over the last 10, 15 years. What we can see in the world today is a lot of different initiatives by governments to get to basically make sure that people who don't have jobs and have no income will get some sort of money to be able to live and be able to be part of the economy. And that we see a lot of diversity in the world today and very different responses. And I think we can learn from what is being done in different countries and try to think not only about how we deal with the financial needs of hundreds of thousands of people in a crisis like we have today, but also how do we deal with the needs of unemployed people after the crisis ends. And I think we can learn perhaps from some countries. I think in Europe have taken interesting steps to deal with that. The idea being that they both make sure people have money, but also they can keep some link to their former place of employment. I think that would be a great idea. And I think another thing we can learn perhaps is how do we deal with small businesses and people who are self-employed, who are not normally covered by unemployment insurance, at least in the Israeli case, but that's true of other countries as well.